touched upon there about how difficult it is to diagnose. And I guess partly that's the variability in symptoms. It makes it difficult to pick up sometimes.
Yeah.
But I'm aware that there are criteria.
The Rotterdam criteria.
Exactly. Yeah. So what are they, and how would a woman get diagnosed, I suppose?
Yeah. So there's 3 criteria, and to have a diagnosis, you have to have 2 of those. So one is that you have irregular cycles. But again, like I said, you don't necessarily have to have PCOS. The other is that you have cysts seen on the ovaries, or more recently, we're now able to check a hormone called anti-Mullerian hormone, or AMH. And if that's elevated, then that can be used instead of a scan. And the third one is that you have raised testosterone levels, or you have symptoms of raised testosterone. So as I mentioned, the typical acne, excess bodily hair, oily skin, that type of thing.
And I always think it's interesting that those criteria, you say you need 2 of them out of 3. So you can be diagnosed with polycystic ovarian syndrome without actually having cysts on the ovary.
Absolutely.
Which is, I think it's confusing. Yeah.
It's really confusing. And I sometimes see that sadly women are given a diagnosis that they don't have PCOS purely on the fact that they've had a scan and they've not seen it, cysts on the scan. Yeah. But however, they've not looked any further to see whether or not they have. So it's important to be assessed by those 3 criteria.
Yeah, to make sure the hormone levels and everything are as they should be.
Yeah.